Welcome back. We are so grateful to you as our community, and we're just thankful that you're here with us this week. And in this episode, we're going to answer your questions about the pandemic, about stress related to the pandemic, about challenges you're having at home, and lots of other things.
But before we do, whatever you learn, if you could just keep notes, I think that's a great thing. I'm always writing notes to myself on what I want to keep. And then take a picture of it, post it on any of your social media sites about how this episode may help you. So question number 1, natural remedies for OCD, please.
Exercise for sure.
Exercise boosts serotonin. So it's actually one of the most searched terms on the internet. How do you naturally boost serotonin? Exercise, smart carbohydrates. So people who have OCD probably should not go on the
keto or strict
diet
keto.
Or keto. It can make them pretty irritable.
Yeah, Chloe, our 17-year-old, she wanted to, be really healthy, and so she did a really strict version of keto. And I kept telling her, you probably need some more carbs. She started spinning on negative thoughts, and so because she's got a super busy brain. So be careful if you've got a busy brain or OCD. You probably need to throw in maybe some sweet potato or half of an apple with some almond butter. You don't want to go crazy. Don't have dumb carbs, but some smart carbs can actually settle you down. And then also, what about things like GABA or 5-HTP?
5-HTP, so serotonin mood support, or happy saffron, or BrainMD supplements can help. GABA can help the anxiety. And then thought stopping. So when you get a thought in your head that's happened more than 3 times, get up physically and go do something else. And when you are tempted to check, don't. And you're like, oh, well, that's not easy. And I know initially the anxiety will skyrocket, but every time you give in to the compulsive behavior, you make it more likely you're going to give into it again. So fighting the urge can really help fight OCD.
When you talk about thought stopping, it reminds me when I meditate, because sometimes, you'll have these random thoughts pop in your head that you don't want to think about. And you're trying to settle yourself down and calm yourself down. And all of a sudden your list pops in your head. And I always imagine a big broom just sort of pushing it away. It's like, okay, take a deep breath and then just start over. Don't beat yourself up. Just start over.
Yeah, that's really great. Hey, I also want to read a review. We haven't been reading reviews. Oh. Brain Warrior Equals Better Life by Delta 2006. I was delighted with the recent episodes on interactive metronome. I've used this intervention with children with autism and ADHD and adults with sensory processing disorders, and with a 95-year-old woman post-stroke. The elderly woman regained her ability to use both of her hands together to prepare simple meals. Her standing, balance, and tolerance improved from 2 minutes to more than 30 minutes. Her daughter reported that her mother seemed sharper after receiving the interactive metronome and occupational therapy. After the intervention during my personal training period, I noticed that my typing speed, previously at 60 words per minute, was considerably faster. I recommend the podcast to teachers and families with whom I currently work.
I love that.
Keep the episodes coming.
So apparently that episode on the metronome it skyrocketed. It did incredibly well. It was one of our best performing. And what I love about our podcast is there's things that we get to research all these things and learn all these things from these experts. I didn't even realize that was a big therapy. I didn't realize it was as big as it was. And it just was people were so interested in it.
You should hang out with me more often.
I know.
All right. Another question. Can COVID-19 cause brain damage? We answered that one. The answer is absolutely it can. And your best defense against COVID-19
immunity.
Is your immune system.
Keep your inflammation down and your immune system strong.
Along with that question, what are the lingering side effects? Fatigue seems to be one of the real.
But I don't know that we really know long term.
Well, we don't, because this thing's only been known for this year.
So I worry about, because of this micro-clotting, I worry that long-term damage to organs is what we're going to, but it's like a slow burning fire, kind of like inflammation, but it's going to start showing up later. Yeah. So what's going to happen to the brains of children with ADHD and autism spectrum disorders from wearing masks? Not only their brain health due to lack of oxygen, but also their social skills due to not being able to properly see people's facial expressions because everyone has a mask on. Hello, this has been my concern all along. So I've been really worried about
there
this.
There are whole societies that wear facial
and that
coverings.
doesn't mean that it's not bad for you.
No, but I think you should not put everybody on an N95 respirator. That facial coverings do a couple of things. One, they decrease the spread. And two, it just reminds you you're in the middle of a pandemic. We need to be thoughtful and careful on how we interact with people.
So people like this about our show, most of them, is that we often have some spirited interaction about this, because I agree with you about obviously that's rational. You want to slow the spread of the virus or stop it. But I actually really resonate with this person who wrote this. Having 3 kids at school, and one of them is 10. We've got our 2 nieces living with us. So the 10-year-old, I worry these kids, one of 2 things is going to happen. They're not going to be able to have their normal activity level. Obviously, they're already slowing that down, but they're not going to get that exercise, because I got to tell you, when I wear a mask and I'm out moving and it's hot outside, I feel nauseous, dizzy, like I don't feel good. So these kids are so active, it's going to really decrease their activity levels. And she had a good point about kids with ADD. They really need to be able to move. And so I actually really resonate with you when you're talking about this. And I don't necessarily have the answer. And I think that's part of why they're doing distance learning. At least in California, we're starting school at home because we couldn't agree on that. The parents and the teachers and the district could not agree on many of those things. And then additionally, though, I agree with you about the facial coverings and being able to read people's faces, because I really do think that being able to read people's faces, understanding social cues is vital. So we need to come up with an exercise. If people are wearing masks, we need to really have some way to help these kids understand.
Well, and perhaps when they're exercising, they're not wearing masks.
But they haven't come up with that yet in California.
That, we just have to be thoughtful and careful. The whole issue with masks and autism is really hard, because those kids have sensory processing disorders. They don't like change, and it becomes really painful. On TACA's website, TACA now.org, they actually have videos about how to manage kids with ADHD and autism and masks.
And that's so critical. Do you remember the day Chloe came home? Our daughter works at a restaurant, and she came home almost in tears. She felt so bad for this woman that came to the she's a host, and it's an outdoor restaurant, but you still have to wear masks to your table. And it's just a rule, and everybody has to do it. But this woman came, and she had a child who was autistic. And, some of the people had the attitude, well, then don't bring your kid out. If you can't get your kid to wear a mask, then don't bring your kid out. But my daughter had a chance to actually talk to her, and just her heart broke for this woman, because she's like, I can't leave my house. I can't go to the grocery store. We don't really think about those implications for people until you really hear it from their perspective. And so Chloe went and talked to her manager. She's like, is there anything we can do? And they made it happen. They took her through a back way where she wasn't going to be exposed to people and isolated a table for them. They actually made it work. So I think using your voice, my point is, if you actually don't just get angry and frustrated with people, but actually take a minute to try to connect with people, gain rapport, and get them to hear your story, I think you're going to find more people will want to help you. So,
all right, one more question. Would really appreciate, this is from Jesse Batoni, would really appreciate it if you can tell me which brain ND supplements would help my temporal lobes and help me focus. So focus and energy for focus. And we often like GABA calming to help relax, prevent temporal lobe issues. We're so grateful that you listen to the Brain Warriors Way podcast. If you've learned anything, please leave us a comment, question, or review from Brain Warriors Way at brainwarriorswaypodcast.com. Whatever you learned, post it on any of your social media sites, hashtag Brain Warriors Way podcast. If you share it with the people you know need it, we would be grateful as well.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.